Now we're going to move into another area of new data exploration, and we're going to hear from Tsou, who's a professor in geography at San Diego State University and is the director for the Center of Human Dynamics in the Mobile Age. Ming is an expert in GIS system and has a variety of very large grants and has been instrumental in the community, and today is going to be talking to us about Twitter and social media in public health research.
Okay. First of all, thank you for inviting me to this meeting, and I'm glad to have this opportunity to share my research in the Twitter and the social media for the public health research. I also want to mention one of my colleagues from the Human Dynamics Center in the Mobile Age, Professor Eric Buha, also joined with me today. So before we start today's discussion, I want to give you a very unique definition about big data from my own perspective. So what is big data? I think big data is about human. We create the big data. The data is a large dynamic data set. It's created by or derived from the human activity, communication, movement, and behavior. So when we talk about big data, we are not going to focus on the big volume. We should also think about the big ideas, big impacts, and big changes for our societies. So because the data, big data is created by human beings, we as a nature, we are very messy, noisy, and unstructured. Yeah, so that's the challenge of the big data and analytics. So I want to share the first slide, the picture with you. Anyone can recognize who is the person behind inside the picture? Steve Jobs, yes. So it's a very messy bookshelf, but think about how did you organize in your book, in your bookshelf? That's how we organize information. A lot of time we use in the spatial metaphor to put a similar item books in the same shelf. I would want to compare to my bookshelf. This is my bookshelf. It's much organized. Maybe that's the reason I'm not so creative as a Steve Jobs. Yeah, but everyone has different way to organizing your information. And different way methodology will actually facilitate our understanding of big data. So we really need a collaboration from everyone, from the linguistic, from the geographer, from computer science, from the data mining person. I am a geographer. I wonder how many geographers in this room? Uh-oh, I'm the only one. But what I can contribute to the community is to bring this geospatial technology and GIS. And then I think geography is very important to understand and integrate the big data because information happens somewhere and sometimes, always. So when we're combining those time and space together to study the context of information will help us understand the content, the big data in a deeper way with their subjects. So really this is my hope to encourage people to adopt the concept. But also the challenge of big data is about integration, about the fusion. So with using the GIS, Geographical Information System, we can help us to explore those spatial temporal relationships in both linking from the cyberspace, the network space, from the Twitter, Facebook, Instagram, to the actual geographical location. So we can overlay with different layers from public health, like a HIV case study or the disease outbreak, with the social media, with the demographic layer, with the socio-economic layer together. Yeah, so this is a tremendous potential if we can integrate, combine the data together. So now I want to show one of my research example. We're using the geo-target social media, especially in the Twitter, to analyzing the disease outbreak in US, especially for the flu outbreaks. You may ask me why we use Twitter. If you go to the research landscape, you will find out that 80% of research are using the Twitter because there's a lot of reasons behind that. The first reason is free and open access for the data. You can through their API, write a program, download the data immediately. Yeah, and also it's a very large user base. Today, in 2015, there's over 500 million Twitter users, and very popular in US, Europe. But it's not very popular in China, Taiwan, or Korea. In China, there's a similar platform of a social media called Weibo. Yeah, and easy to program, but with the free access API in Twitter, you have a 1% limitation. If you want to know the detail, I can tell you later. But if you have money, you can buy the data from Twitter. You can buy the 100% data, but it's very expensive. You can also buy the historical data. Another component of Twitter is it has a very rich metadata component. I'll show you in the next slide. And in addition to Twitter, there's other possibility of social media. You can have API like Flickr, Instagram, Foursquare, Yelp. But people also want to ask why we are not using the Facebook. Facebook is the most popular social media platform today. However, by nature, the Facebook is a closed system. So their API is very limited, very unprotected, and there's no stream time topic data feeds. Yeah, so that is a lot of limitation to prevent the researcher to go to the Facebook, and most of them do it on the Twitter. So here is the example we can get from the Twitter data. So before I come to this conference, I'm just using our search API to search the two keyword HIV test, HIV testing. So you can see you have the timestamps when exactly the time they create this message, the content of the message, the text, and the user who create that, and their location. This location is from their user profile when they create their account. And then they're including the hashtag, retweet, individual user, how many followers, how popular this person on the Twitter, and the time zone, source, language, and the geo coordinate. So, because I'm geography, so I'm interested in what kind of spatial information we can get. There's about 50% of the user can define their location from the city level, but this geo tag is actually latitude and longitude can pinch down very precisely to street level, but only about 1% of the Twitter message has this tag. So there are some limitations about geo-referencing in the Twitter data. So to create this, after we collect the information from those API, we need to process, filter, and visualizing those data. So in our research, we're using a different way to analyzing or filter the data into a meaningful insight or the actionable items. So we're using the different filter mechanisms like keyword, retweets. Some Twitter have a URL to remove that. And also we are adopting the machine learning procedure from the computational language like a SVN or decision trees. And also we're using the GIS to analyze the spatial pattern and the temporal pattern. Finally, we create this overall visualization tool using the programming language, create this we call the smart dashboard. So here's one example we create analyzing for the flu outbreak in the US last year. So you can see there's a two line in this graphics. The red line is the data provided from the CDC weekly from the national ILI data, illness, likeness, influenza. The purple line is our tweeting rate weekly from our database after the filter information. You can see these are very correlated. The correlation efficiency can up to 0.84. We also can analyzing those patterns at the municipal level, like San Diego, because we have a developed, it's called the geo-target social media analysis API. So we are working together with the San Diego County Office of Human and Health Services with their lab test confirmed flu case compared to our tweeting rate weekly. The correlation even higher than national level is 0.93. So because this is a very interesting direction, so our team has developed this online web-based software called the Smart Dashboard Social Media Analytic Research Testbed. So I'm going to share with you this video, just briefly, about 3 minutes. Yeah, I can do that, yeah.
Smart Dashboard is an online geo-targeted search and analytics tool for social media created by the Center for Human Dynamics in the Mobile Age at San Diego State University. Using automatic data processing for Twitter messages, Smart Dashboard helps researchers search tweets in different cities, filter noise, such as removing redundant retweets and using machine learning methods to improve precision, analyze social media data from a spatio-temporal perspective, and visualize social media data in various aspects, such as weekly and monthly trends, top URLs, top retweets, top mentions, or top hashtags. Smart Dashboard uses multiple data mining programs, GIS methods, and advanced geo-targeted social media APIs to track selected topics in space and over time. Researchers can utilize Smart Dashboard to visualize, characterize, and predict trends in these topics in different cities. The focus topics currently include flu, whooping cough, wildfire, drugs, Ebola, Nepal earthquake. There are multiple components to searching, processing, and visualizing social media messages from Twitter search APIs. The filtered statistics of the focus topics and geo-targeted cities are visually represented in the Smart Dashboard. Let's take a look at the features of the Smart Dashboard interface. The left panel provides the list of targeted cities to choose from and shortcuts to different functions. The top index numbers display the number of tweets collected from the current day, past week or month, as well as total tweets collected. The trend feature provides a graph depicting the number of tweets which can be adjusted to show only filtered, unfiltered, or both. Users can switch the view to monthly, weekly, or daily. The points on the line chart can be clicked to reveal interactive queries of actual tweeting text. Top Media displays the most shared images. Top shared URLs are shown here. The word cloud function shows the most prominent conversation keywords, which can be selected to view tweets using those particular keywords. The frequency of words is charted below. The Tweets and Cities function can show the normalized tweeting rates by city population. Base maps can be changed to preference. Top retweets are shown here.
This is a famous guy, like a science guy. We talk about the flu shot.
Additionally, we've created a separate spatial analysis of GPS tagged tweets in a separate viewer called GeoViewer, which can be accessed online for more information. We hope you enjoyed learning about the Smart Dashboard. To keep updated with our research, be sure to visit our website. Thank you.
Okay, I hope you enjoyed the video. I want to thank my student Stephanie to create this very nice videos. Yeah. So before I come to this workshop, I also asked my students to create a pilot study for the HIV, like a keyword. So what we did is using the keyword HIV test and HIV testing to analyzing, collect the tweets in the last month through the different region, the whole world, and also we aggregated in California and Texas. So you can see during the last month, we got 13,000 tweets worldwide, but only 300 from California, about 150 in Texas. So what these tweets tell us about HIV test. So this is a screenshot of HIV, the dashboard. We found out from the temporal trend, there's a two peak. One is a June 24, the other one is June 26. So we want to know what happened to this day. It turned out that there's a national HIV testing day on the June 27. But why the peak is on the 26, not 27? So we dig into the individual tweet to see what happened. We found out that a lot of the social media campaign person tweeted about the day before the actual awareness day. They encourage people to take the test tomorrow. But also we found out that because of time zone differences, so a lot of tweets from the European is actually tweeting on June 27. But because of time zone, they were converted into the June 26. So what exactly happened? How did we explain this June 24? And also the peak on June 24, we found out that individually there's a lot of people talk about there's a free HIV test out of Walgreens in Chicago, which I have no idea this happens, but by analyzing we got the insight. And also there's a lot of campaign. They say Saturday is a National HIV Testing Day. Another very interesting aspect is when we compare this spatial temporal trend between the worldwide and the California and Texas, we're realizing that every single region has different pattern. We call the signature. So we cannot just analyze in the social media trend within the whole group or the whole nation. Every voice is from different region and different place. The same thing happened when we talk about this popular discussion. On the nation, the worldwide, the most popular URL is actually this website. It's called HIV Test. It's actually talk about the STD disease in different language. In California, the most popular website is the locator of the HIV test. So it's different compared to different cities. Yeah. The previous study, we also can analyze in the social media from the macro level versus micro level. So we can actually dip into individual statements, like a micro level, to understand their behavior, understand their risk perception. This research will require a lot of computational linguistic analysis. I just want to show you a few examples I collect from the Twitter we using for the testing. Say I took an HIV test to win the ticket. So why that's maybe that one of the motivation people want to take the HIV to win the ticket. So I guess it's a win-win. Yeah, but also say I always get nervous from an HIV test. I don't know what scares me the most, the prick or the result. Yeah, so understand that if we accumulate enough information, we can try to understand those risk perception from the audience. In addition, we can also analyze in the geolocation. So one of our tools is called GeoViewer to collect only the geo-target tweets. So we collected in the last 6 months in San Diego and searched for HIV keyword. We found out there's a 2 cluster in downtown San Diego right here. One of the cluster is actually this group, say We Are HIV organizations. Yeah, the other one is actually this group is a San Diego press release, the media already announced some media research. But we also find out interesting is there's some small cluster in here. If you know San Diego, you know this is a Hillcrest. It's actually a very active community for LGBT group. Yeah, so, and each then is treated from the different people. So there's an interesting spatial perspective. So this is just a very preliminary study I want to share with you during the workshops. And also social network analysis is also huge potential. We can analyze who is tweeting who is following, and who is retweets those informations. The example here is not using the HIV, but we did done the previous research on using the whooping cough. But there's a similar concept can be applied to the HIV research. Finally, I want to highlight that there are still a very significant limitation and challenge for the social media. The first one is the user profile. The user in the Twitter cannot represent all population, but the message we get can provide us some warning signal or real-time update about the change of information. If you want to know what exactly the Twitter user, I can give you the thumbnail. Is most of them are young people. 70% are between the 15 to 25 years old. A lot of them is from the urban rather than rural areas. And percentage-wise, the African American adoption is higher than other ethnic groups. And also a lot of journalists join this Twitter. Also be aware, a lot of data you collect is not human being. It's from the robots. There's a lot of advertisement campaign using the computer-generated robots. Finally, I want to say about the privacy issue. This is also one of the big concerns on the social media and the Twitter. People talk about the big brother and the puppy tweet. I want to show you this example. This is one tweet say that I need help to pay for my trip to AIDS Watch 2015. Can you help me to donate? And that person tagged their geolocation. Any danger for this tweet? Anyone think? Anyone know the exact date of AIDS Watch 2015 conference? If I'm the criminal, If I want to burgle this person's house, I would know that person is not at his home. He's traveling on that day. So it becomes a target. So a lot of the privacy issue is beyond your original thought. There's a lot of complicated information. When we link in the data with the date and time, you have a problem. Yes. So that will be conclude my presentation today. Okay, thank you for listening. Yes. Yeah, I think I want to bring the point is when we conduct the big data research, especially in the social media aspect, a lot of people think we are objective research component or result, but in fact it is not. Most of big data in social media is very subjective, because when you processing the data, when you filter data, which keyword you're going to collect first, it is biased. Which keyword you're going to filter out, what kind of method you're going to do machine learning, the SVG or other things, the way you processing the data, a lot of it from the actually personal perspective. So we have to be very careful about the result or interpretation of big data, because there's a lot of human intervention, explanation inside the outcome of big data. So we have to be careful. It's very different from the traditional scientific data we gather from the lab test or the machine or the monitor. Yeah, because data is created by the human being and processed by a human being. Even if there's a computer to help us, but we still have a lot of subjective procedure. Yeah, I think I want to emphasize in the multidisciplinary or transdisciplinary integration is a key component for big data research, because everybody here actually is from different disciplines. So we are talking about different language, different ontology, but how do we understand each other? From the technical perspective, big data is easy to solve the problem, but from the society and from the community perspective, we need to talk to each other. We need to communicate. We need to try to understand what is the language in your field can be borrowed for my discipline. So I think integration, cross-discipline is a key for the big data.